Have you ever stopped to think about how weird healthcare is? I mean, on the one hand, we've got these incredible, life-saving technologies. But on the other, the whole experience can be just frustrating, confusing, and so expensive. Well, that entire system, it is on the verge of a massive, massive transformation. So let's dive into this revolution that's already in progress. To really get a sense of the scale here, let's just start with one number: $4 trillion. That's what healthcare costs have been trending towards in the US alone. Trillion with a T. It's a number so big it's hard to even wrap your head around, and it puts this immense pressure on everyone: governments, companies, and of course, you and me. This is the core reason the push for change has gotten so urgent. You see, every healthcare system on the planet is wrestling with what's often called the healthcare trilemma. It's this constant, brutal balancing act. How do you lower costs without gutting the quality of care? How do you give everyone access without making it totally unaffordable? The problem is, when you pull on one of these levers, the other two almost always get thrown out of whack. For decades, truly solving this has seemed, well, impossible. But that might finally be about to change. Right now, there's this incredible wave of new technology emerging, and it's promising to tackle these challenges head on. And we're not just talking about small little improvements. We're talking about fundamental, game-changing shifts in how we monitor, diagnose, and treat illness. Okay, let's look at a few examples, because this is where it gets really cool. Researchers are actually creating wearable health sensors using nanomaterials mixed with seaweed. Yeah, seaweed. These things are sustainable, and they can track your blood pressure, your pulse, your breathing, all in real time, competing with technologies that cost way, way more. Or think about this. Over 1 million people with diabetes face lower limb amputations every single year. It's a devastating statistic. Now, there's a technology that uses artificial intelligence to design orthopedic insoles that are truly personalized, right down to the individual. The goal? To dramatically reduce that number by preventing the foot problems that lead to amputation in the first place. And what about protecting the people who take care of us? Scientists have developed this desktop device that creates a protective air curtain to block aerosols, while also using UV rays to zap viruses. It sounds simple, right? But it's an idea that could drastically reduce viral exposure for healthcare workers during just routine checkups. So, what's the common thread here? What's the secret sauce connecting personalized insoles and data from seaweed sensors? It's artificial intelligence. AI is the engine that's making all of this possible. It allows machines to learn from these massive amounts of data, spot patterns that we humans might miss, and ultimately make decisions that can totally transform patient care. But here's the twist, and this is really important. As exciting as all these gadgets are, technology by itself is not a magic bullet. You can't just throw cool tech at a broken system and expect it to work. To truly fix things, we need a revolution, not just in our tools, but in our thinking and in the fundamental business models of healthcare itself. And this shift in thinking brings us to a whole new model for healthcare. For the longest time, the system has worked on a fee-for-service basis. Think of it like taking your car to the shop. You pay for every part, every hour of labor. The incentive is just to do more stuff. The alternative, which is gaining huge momentum, is value-based care. This is more like a subscription service to keep your car running perfectly. The system rewards what actually matters to you, the patient, staying healthy. And this quote just hits the nail on the head. Jens Dierberg-Wittrom basically argues that we can't just rely on doctors to be heroes working in a flawed system. The system itself has to be designed to produce the right results. It's about systemic change, not just good intentions. So how do you actually build that new system? Well, researchers at Harvard came up with this framework. They identified 6 key things that determine if a healthcare innovation will actually succeed in the real world. And notice, technology is just one of 6. You have to get the structure right, the financing, the regulations, and crucially, how you measure and pay for good patient outcomes. All 6 of these pieces have to fit together. Now, of course, this path is not easy. Not at all. This kind of transformation comes with some really serious roadblocks, and it forces us to ask some very, very hard questions. We're talking about major hurdles, things like data privacy, and the huge challenge of making sure AI tools are accurate and fair for everybody, not just one group. Innovators have to get through these mazes of regulatory approvals, and then figure out how to plug their shiny new tech into hospital systems that are sometimes decades old. There's even a risk of unintended consequences, like doctors may be avoiding sicker patients to keep their outcome stats looking good. These are not small problems. And that leads to these profound ethical questions. Just think about this one for a second. If an AI gets a diagnosis wrong and a patient gets hurt, Who's at fault? Is it the developer who wrote the code? The hospital that bought the system? The doctor who trusted the AI's recommendation? We don't have easy answers for this yet, and these are conversations we absolutely need to be having. Okay, so despite all those challenges, a new future for healthcare is definitely taking shape. So let's synthesize this and look at the definitive trends that are already here and what they're going to mean for all of us. First, the move to virtual care is undeniable. It is permanent. Just look at this chart from McKinsey. Telehealth usage hasn't just grown, it has exploded to 38 times what it was before the pandemic. 38 times. The convenience of seeing a doctor from your living room has completely changed our expectations. The virtual front door to the hospital is now wide open. And that leads directly to the second major trend, the rise of you and me, the healthcare consumer. We now expect our healthcare experience to be as seamless and easy as our online banking or ordering from Amazon. We want convenience, we want clear pricing, and we want to feel in control. This huge power shift is forcing the entire industry to finally become more patient-focused. Which brings us to our final thought. All of these trends, the incredible technology, the new business models, the new consumer focus, they're all converging. The old model, where you're just a passive person who receives care, well, that's fading away. The future demands more from us. So the real question isn't just what healthcare will look like, but what role you're going to play. Are you ready to be a patient or a participant?